Okay, so starting with the very first question, and it was about a case of poisoning where a farmer who was spraying pesticides in his field, he is now complaining of excessive salivation, then sweating, vomiting, abdominal cramps, and difficulty in breathing. On examination, he has pinpoint pupils, generalized fasciculations, bradycardia, and bilateral crepitations. Now, what is the most appropriate initial antidote? So, let us take the keywords first. What are the keywords which are given to us here? So, there is some poisoning with some unknown pesticide. Now the patient is having excessive salivation, clear? So it means increased saliva. Then there is sweating, so increased sweat. Then abdominal cramps, means there is contraction of the smooth muscles of gut. Then pinpoint pupils, so there is constriction of the sphincter pupillae muscle, right? So this is meiosis. Then bradycardia, that is decreased heart rate. Now I think if you just club all these features together, this is a classical case of cholinergic overactivity, right? So this all suggests that there is increased cholinergic activity, and this is a classical case of organophosphate poisoning. So this is a classical case of organophosphate poisoning or OP poisoning. Now, as we know that there is increased cholinergic activity, so what should be the initial antidote? Obviously, it should be anticholinergic. And what is that? So that is atropine. Clear? So initial is atropine, which will reverse the muscarinic effects. This is the classical presentation of organophosphate poisoning where there is overactivity of cholinergic system. So very easy to diagnose. Increased secretions, increased smooth muscle contraction. So smooth, you can write here, smooth muscle constriction, yeah, right? And bradycardia, as we all know that this is a parasympathetic cholinergic activity. So this is a classical case of organophosphate poisoning, and we should start with atropine. Okay, so I think this is a very basic question and one question which is repeated over the years. So I think all of you can answer this very easily. So just remember, increased cholinergic activity, this is organophosphate poisoning, and since there is increased cholinergic, so what we need to give? Anticholinergic, classically atropine. Okay, so next question. A 40-year-old male consumes illicit liquor which was purchased from an unlicensed vendor. 24 hours later, right? 24 hours later, he has severe headache, vomiting, blurred vision, and progressive loss of vision. Then arterial blood gas analysis shows high anion gap metabolic acidosis. Okay, so this is high anion gap metabolic acidosis. Now, which toxic metabolite is primarily responsible for his visual symptoms? So this is a classical case of there is consumption of illicit liquor, and after that what has happened? After 24 hours, what is happening? Classically, the patient is having blurring of vision and there is progressive loss of vision. So it means there are visual symptoms, and this is associated with high anion metabolic acidosis. Now this is classical for which poisoning? Can you tell me which poisoning is this? So firstly we should know which poisoning is being discussed here. One thing is given here, illicit liquor, and then classically visual symptoms, and third high anion gap metabolic acidosis. Now can anyone tell me which poisoning is this? This is classically methanol poisoning. Okay, so this is methanol poisoning. Now here, this is a very favorite question for exam setters, and just 2-3 important facts which you should know about this particular poisoning. Now based on symptomatology you can make a diagnosis. This is methanol poisoning. Now the question is about the toxic metabolite. Now what is that actual compound which is causing all these visual symptoms? So for that we need to understand the metabolism of methanol inside the body. So once it goes inside the body, it is firstly converted into formaldehyde. Clear? So firstly it is converted into formaldehyde, and what is the name of the enzyme? Alcohol dehydrogenase. Okay, so because methanol is an alcohol, so you can remember alcohol here. So this is alcohol dehydrogenase. Now this formaldehyde is converted into formic acid. Okay, so now this is converted into formic acid, and since formaldehyde is an aldehyde, so the nomenclature of the enzyme is very easy. This is aldehyde dehydrogenase. Okay, so in the first step, alcohol dehydrogenase, which will convert methanol into formaldehyde. In the second step, formaldehyde will be converted into formic acid with the help of the enzyme aldehyde dehydrogenase. So this is also checked at times. So please remember this aldehyde dehydrogenase. So very easy to remember, dehydrogenase in both the steps. In the very first step, alcohol is being converted, so alcohol dehydrogenase. In the second step, aldehyde is being converted further, so aldehyde dehydrogenase, right? Now this formic acid is the toxic metabolite. Clear? This is the toxic metabolite. So what will be your answer? Formic acid. Please don't mark formaldehyde. It is not formaldehyde, it is formic acid. Okay, so one thing which you should know is making a clinical diagnosis based on the symptomatology. Second, you should know the pathway of methanol breakdown, like which step, which enzyme, what product. And third, which is frequently asked, is about the antidote. Now what is the antidote of methanol poisoning? So it is very easy to remember. Just remove the word M from here, so you will get the answer. So what is that? That is ethanol, right? So ethanol is the antidote for methanol poisoning. So these are the 3 important areas from which question is being asked, and this is very important from exam point of view. So please remember it, okay? Methanol poisoning. Chalo, moving forward. A 24-year woman is found unconscious in the bathroom where a gas geyser was running for several hours. Now she is hypotensive and hypoxic, right? So she is hypotensive and hypoxic, and the blood appears bright cherry red. Now, if you find this particular word, bright cherry red, I think the type of poisoning is very easy to answer. I think most of you can answer that. So now what is happening here? Gas geyser running for several hours, and this is in bathroom, so obviously it's a closed space. Clear? There is no circulation of fresh air. Now what has happened, after some time the lady is hypotensive, hypoxic, and most importantly now she is unconscious, and the blood, it appears cherry red color. So bright cherry red color. I think most of you can answer what poisoning is this. So this is a classical case of carbon monoxide poisoning. Clear? This is a classical case of carbon monoxide poisoning, and therefore what you need to do? Obviously you will go for checking the hemoglobin level in blood. So this is how you should approach this question, and again the exam setters are very fond of carbon monoxide poisoning. Please read it properly. It will definitely give you some question in exam. Clear? And there important clue is closed space. Like sometimes there is one question where the car driver is sleeping in the car, closing the doors, keeping the AC on, okay, or some people during winter they are keeping the room closed and they are using some sigdi or some burning some wood so as to ward off the cold. So closed space, there is high chances of carbon monoxide poisoning. So whenever you have any scenario where there is a closed space, think of carbon monoxide poisoning as in this question, right? So we should go for blood carboxyhemoglobin level. So next question, a 32-year-old man is found hanging from the ceiling. During autopsy, the ligature mark is situated above the thyroid cartilage, one important clue, and secondly, it runs obliquely upward towards the mastoid process. Now, which finding most strongly supports hanging rather than ligature strangulation? Because if there is a ligature mark on the neck, it can be ligature strangulation. So how we will say that this given case is of hanging and not ligature strangulation? So Arkagiri. Now here the important thing which you should know is, like, whenever we see a ligature mark on the neck, obviously we have to differentiate two conditions: ligature mark over neck. So firstly we need to look at the location, and number two, we have to look at the orientation. Okay, so if the ligature mark is above thyroid cartilage and if it is oblique, then straight away it is a case of hanging. And therefore what you need to remember, oblique and non-continuous, because in ligature strangulation it will be continuous and it will also create a horizontal impression over the neck, but here it will be oblique and it will be non-continuous. That is very important. So this you need to remember, oblique, non-continuous, above thyroid cartilage, straight away go for hanging. Clear? So the right answer is option B. In either case, because there is occlusion of the venous flow, so there will be facial congestion, that's obvious. It will be in both the cases, but the location, the orientation is very important to differentiate the two conditions. So if it is oblique and non-continuous, and if it is above thyroid cartilage, this is classical for hanging. Okay, so please remember this hanging is very important. Always and always we have a question from this asphyxial death, this topic as such, right? So this is the answer here. Next question. A 19-year college student is brought with agitation, dry mouth, okay, so agitation, dry mouth, fever, flushed skin and urinary retention with markedly dilated pupils, and this is after consumption of seeds from an unknown plant. Which poisoning is the most likely cause here, right? So I think this is one of the most important topics from poisoning. So what we can see here, there is agitation, there is dry mouth, there is fever, then flushed skin and urinary retention and dilated pupils. Yes, I think now see here. Now agitation means you can say this is like delirium, right? So this is 1D here. Dry mouth, 2D. Then dilated pupils, 3rd D. Okay. So what you can see here, there are multiple D's here. So the answer will also start with the alphabet D. Now can you think, okay, before that let me, dry mouth means decreased saliva, right? Then urinary retention means decreased smooth muscle constriction, say of ureter. Then dilated pupil, there is relaxation or again decreased smooth muscle constriction. This is what is mydriasis. Okay. So what is all this? This is anticholinergic. What is this? This is all anticholinergic effects. Because cholinergic is what? Increased secretion, increased smooth muscle constriction. But here what we are seeing? Decreased secretion and decreased smooth muscle constriction. So it is going against cholinergic activity and therefore this is anticholinergic effect. And simply if you find multiple D, the answer becomes very easy. So Arka, Rahul, yes bachcho, all of you are absolutely right. The answer is Dhatura. So anticholinergic, Dhatura, cholinergic, organophosphate. So this is what you need to remember because these two are very commonly asked in exam and the reason is same because students they often mix up. So you have to remember cholinergic, organophosphate, anticholinergic, your Dhatura. Okay, so please make sure you don't mix up, and the easiest way to remember is multiple D's. If you find any clinical presentation where you see multiple D, delirium, dry mouth, dilated pupil, go for Dhatura. Clear? So please remember this. And you must have heard of like dry as bone, red as beet, all those saying for this particular datura poisoning. Okay, chalo. Next question. Uh, Now this is also very commonly asked. A 30-year-old male is admitted after a road traffic accident. So there is a road traffic accident. 6 hours later, he becomes drowsy and develops ipsilateral pupillary dilatation. Now the CT is showing biconvex hyperdense lesion. So what is this actually? So there is a case of road traffic accident. After this, what is happening? After 6 hours, now what is happening? The patient is becoming drowsy and CT scan is showing biconvex hyperdense lesion. Very good, Arka, very good, bache. So now here, see what clues you have been given. Now this is known as the lucid interval. Okay, so after trauma, patient unconscious, then gaining consciousness, and then again becoming unconscious. So this is lucid interval. And secondly, this biconvex, this is very important. So biconvex is like this. So this is biconvex, or in simpler words, what you call something like lemon. So biconvex hyperdense lesion on CT scan, lucid interval. Yes, this is a classical case of extradural hemorrhage. So this is a classical case of extradural hemorrhage. You can also call it epidural hemorrhage. And yes, which vessel is broken? Middle meningeal artery. So extradural hemorrhage is very important from exam point of view. Please read it properly and make sure you don't mix up with subdural hemorrhage, which is entirely different entity. Okay, so for this particular thing, this is extradural or epidural hemorrhage, and the classical clue is lucid interval. Okay, please remember. Next question. Now this is one of the easiest question, but yes, from the very important topic. A factory worker presented with abdominal pain, there is vomiting, there is salivation and garlic odor from his breath after accidental exposure to an industrial chemical. Okay, Rahul, absolutely right. Yes, yes. So here you can see what the patient is having: abdominal pain, vomiting. Now you can see these are actually GI symptoms, and classically the clue is garlic odor from breath. So the moment you have garlic odor, I think everyone can answer this. Yes, Arka, you are absolutely right, bache. This is arsenic. Now arsenic is very important. Please read it in detail as much as possible. So the classical hint is garlic odor from breath. Along with GI symptoms, think of arsenic. Next question. A patient with chronic opioid abuse is found unconscious and respiratory rate of 6 per minute with pinpoint pupils. Now IV antidote was given and he became conscious. So which antidote was given? I think this is again very classical. So a case of opioid poisoning here, because what is happening here? The patient is unconscious, there is respiratory depression, but most importantly, there is pinpoint pupil. Clear? So this is a case of opioid poisoning, as already mentioned in the question. But the moment you find the word pinpoint pupil, always think of opioid poisoning. So in such a case, what you need to give for opioid, the antidote is naloxone, right? For opioid poisoning, the antidote is naloxone. Fine. So please remember naloxone for opioid poisoning. Clear? So please remember this. And the classical hint is pinpoint pupil. Next question. A decomposed body is recovered several weeks after disappearance. Now, the investigator needs the most reliable specimen for DNA analysis. Now, from where it should be collected? Now, the important keyword given here is decomposed body. So, the body is already decomposed. Now, which tissue will be preferred for DNA analysis? Now, here, when the body is decomposed, we have to think of a structure which resists decomposition for a long period of time, right? So, when this classical word is given, so think of a tissue which resist decomposition for a long period of time. And I think most of you can understand which tissue in the body resist decomposition for a long period of time. I think if we recover a dead body after many months or even after years, what we can see? We can see only skeleton. So it means which tissue is preferred in such a case? It will be bone. Clear? So bone with, in this case it is given femur. So femur with bone marrow. And other is teeth. Clear? So these tissues, they resist decomposition, and therefore even if the body is decomposed, obviously liver, skeletal muscle, spleen, all will go away. So the best is bone with its bone marrow. So here it is femur with bone marrow, right? Ark agree, very good bache. Okay, so this is how you need to remember this. So the only catch is like the bone is the last tissue to undergo decomposition, you can say like that. Now, a woman alleges sexual assault 12 hours after the incident. Now, which specimen is most valuable for detecting the assailant's DNA? So, like 12 hours after the sexual assault. Now, from where you will take the specimen for recovering assailants or the culprit's DNA? So, I think it's very basic question. All of you can answer this. As it is a case of sexual assault, so obviously what we need to do? We need to go for a high vaginal swab. So from here we can collect the seminal fluid as well. So obviously this is high vaginal swab, since this is a case of sexual assault. Clear? So this is very easy to answer. Very good, Arka, very good. Now, next question. A man dies after sustaining electrical injury while repairing a live wire. Autopsy reveals a crater-like lesion with raised margins, and where it is present? At the point of the contact. So it means where the wire touched the skin, there was a crater-like lesion with raised margin. So something like this. So crater means depression. So there is a crater-like lesion with raised margin. Now here the electrical injury is very important, and at the point of contact. Now what will be the answer here? Very good Arka. This is Joule burn. Okay, so Joule burn related to electrical injury, and that is actually the point of entry of the electrical current inside the body. So that's Joule burn. Please remember. So next question, again from a very important topic. Now here a body was recovered from water. Okay, so body was recovered from water, and there was fine white froth at the mouth and nostrils, and there was water filled lungs. So now what do you think here? Obviously the body is recovered from water, so it is a case of drowning. Okay, now what is happening here? What has been given here? There is a fine white froth at the mouth and nostrils, and obviously there is water filled lungs. Now what all this suggest? Yes, anyone? See, this is a classical feature. This is a classical feature, fine white froth, and this suggests that this is antemortem drowning. Okay, so this is a case of antemortem drowning. Ante means before, mortem means death. So it means the patient was live at the time of being drowned, because sometimes what happens, the patient has been the victim has been killed by some other means, and then his body is thrown into the water, and just to misguide the police or the investigating authority that this is a case of drowning, but that is actually post-mortem drowning. But here, if there is fine copious white froth coming from the mouth and nostrils, and even if you wipe it off, it will come back again. So that's an important feature. Comes back again on wiping. If you try to remove it, it will come back again. So that's a classical feature of antemortem drowning. And yes, since the patient was breathing at the time of being drowned, so the water will move inside the lungs. So water filled lungs. Yes, this is a classical case of antemortem drowning. Clear? So this is the classical clue, fine white copious frothy discharge from mouth and nostril. So next question. A 35-year-old prisoner is found dead in his cell, and then there was multiple superficial parallel cuts which are noted over the wrist, in addition to one deep incised wound severing the radial artery. Now these superficial cuts are best described as. Now I think most of you can answer this, because this is a classical case and it has been asked many number of times. So very good, Arka, very good. So there are multiple superficial parallel cuts. Clear? And these are known as hesitation cuts. And this suggests what? Suicidal or homicidal? So these are the hesitation cuts, and these are classical for suicidal. Right? So the fellow will try to cut his artery, but because that's a painful procedure, so initially he will try with some superficial cuts, and finally he will make a deep cut, cutting the radial artery, and because of hemorrhage he will die. So this is suggestive of suicidal cut injury at the wrist. Okay, hesitation cuts versus defense wounds. Now, see, hesitation cuts, look at the location. So one of the important thing is location. So wrist, because what is happening? The fellow is trying to cut his radial artery, but defense wound, it can be anywhere based on the position of the victim and the culprit. So it can be anywhere, and moreover, there will not be multiple and superficial. And thirdly, parallel, because what is happening? The patient is trying to cut the radial artery. So initially, because of, you can say, pain or fear, he is not able to make a deep cut. So all majority of the cuts are superficial. But in defense, depending on the force of injury, it can be deep, and there is no concept of superficial, because the culprit is trying to injure the victim as much as force, so it will be a deep cut rather than multiple small superficial parallel cuts. So that's very easy to differentiate. But this is the classical word: multiple superficial parallel cuts, and then there will be only one deep incised wound cutting the artery. Okay? And there is one more important thing which you need to remember here for suicidal. See, if a person is right-handed, where he will cut? Obviously on the non-dominant side. Clear? So it will be on the non-dominant side. Suppose if the patient is right-handed, obviously he will hold the knife in the right hand and he will cut the left wrist. Clear? So that is also one very important clue. Whereas defense wound can be on the dominant side, because that the reaction, because of reaction, that limb will be lifted first. So that is most over the dominant side, and suicidal are usually on the non-dominant side, because the dominant hand is used to create those cuts. Okay, Arka. So moving forward to next question. A 45-year-old man with severe depression is found unconscious after ingesting unknown quantity of sleeping pills. So there is no count like how much pills she has taken. Now she is hypotensive, there is respiratory depression with absent reflexes. Now which poisoning is most likely here? So the lady is a known case of depression, and she has consumed unknown quantity of unknown number of sleeping pills. And now what has happened after that? She is unconscious, then BP low, hypotension, then respiratory depression, which is very important clue here. So there is a respiratory depression, so, and absent reflexes. Yes, what you can think? Now here, see, the classical word respiratory depression, this goes more in favor of barbiturate poisoning. Okay, so respiratory depression, always think of barbiturate poisoning, right? Now for cocaine, I think cocaine has nothing to do with sleeping pills and all. And moreover, whenever there is a question about cocaine poisoning, you will have that classical description of formication, or what you call cocaine bugs. So right, so whenever a question is about cocaine bugs, cocaine poisoning, classically you will have this particular word, cocaine bugs. And I think most of you must be knowing what is cocaine bugs, like crawling of insects under skin. So that's the classical word. Okay, so for cocaine is very easy to identify. Datura organophosphate we have already discussed. So the best answer which comes out for this particular question is barbiturate poisoning, and the classical clue is respiratory depression. And then moving forward to the last question for today's session, a 26-year-old male is arrested for drunken driving. Now he appears intoxicated, but he is refusing blood sampling. Now which sample can be used to provide legally evidence of alcohol consumption when blood collection is not feasible? Now what do you think here? So here is a case of alcohol consumption, right? So this is a case of alcohol consumption, and the patient is not willing to give blood sample. Now which sample you can use to check alcohol? Yes, Arka, very good bache, this is urine, right? So we can go for urine alcohol content. So although the ideal is the blood alcohol, but in rare case, if it is not possible, then we can go for alcohol estimation in urine. Okay, so that's just a basic question. So with this we end today's session. Very shortly I'll come up with one more subject. Till then, keep on studying. God bless.